Coming up next on Insights on PBS Hawaii, what do we need to know about dengue fever in Hawaii? Aloha and welcome to Insights on PBS Hawaii. I'm Malia Maddock. 160 people have contracted dengue fever in Hawaii since September, marking the largest outbreak of the mosquito-borne illness in the state since the 1940s. Dengue can cause high fevers, headaches, rashes, and joint pain, and severe cases have earned it the nickname break bone fever. The state has been praised by the Centers for Disease Control for its efforts to contain the outbreak, such as spraying for mosquitoes and educating the public. However, critics say more should be done to control the spread. Tonight on Insights, what do we need to know about dengue fever in Hawaii? We want to hear from you during tonight's show. Call 973-1000 if you live on Oahu, or 800-238-4847 if you're calling from a neighbor island. You can also watch Insights streamed live at pbshawaii.org. Just click on the title of tonight's show or find us on Twitter at PBS Hawaii. Now to our panel. Dr. Virginia Pressler is the director of the State Department of Health, a position she's held since last December. Her department has launched a Fight the Bite campaign to educate people about how to prevent dengue fever and is working with Hawaii County Civil Defense to contain the outbreak. Senator Russell Ruderman represents the district of Puna, an area said to be at moderate risk for dengue fever. Senator Ruderman is concerned that efforts to control the spread of dengue in his district aren't effective enough, and he also believes that outreach efforts have been slow and incomplete. Breland Dupertis recently recovered from dengue fever, which she believes she contracted in November while working in Ho'okena. Ms. Dupertis tested positive for the virus when she was admitted to the hospital for her symptoms, which included severe body pain, a prolonged 104-degree fever, and a full-body rash that lasted about 12 days. Daryl Oliveira has been the Hawaii County Civil Defense Administrator since 2013. Civil Defense is the lead agency in charge of containing the dengue fever outbreak and has hosted a series of community meetings to inform residents about the illness. Thank you everyone for joining us and coming to us from the Big Island for tonight's show. We appreciate it. Dr. Pressler, may I start with you? So the 160 figure, it was updated today. Can you give us a snapshot of where this outbreak stands?
Well, today the number is 160. There's only, of that 160, probably 6 or 7 of those individuals are infectious with dengue fever now. The others have recovered from dengue fever and have antibodies to it, to that particular type of dengue fever. So there's only about 6 or 7 that are currently infectious.
Does that mean that this is now easing off? Do we know?
We can't say that yet. When we look at the what we call the epi curve, the number of cases that we've had over the last several months, we've had a couple of days in the last week where there were no new cases. We had 3 new cases today. We've had, a couple of new cases pretty much on a regular basis. So we won't be satisfied that we have ended this current outbreak until we've had at least a month without any new cases being identified.
Ms. Dupertis, you've survived this. Did you know much about this before becoming infected?
A couple of my colleagues thought that they had it, and they had texted me, we're sick, we have dengue fever, and I just did the obligatory, I treated it like a flu, like, oh, I hope you get better, let me know if I can bring you chicken soup. I had no idea, I didn't even think to Google it, or I didn't think anything of it. I thought maybe they were guessing or being extremists. So I'm going to say no, I didn't really, even though I was kind of warned, I didn't understand how much precaution I should take.
So the day that you believe that you may have contracted this, were you sort of aware of the risk? What happened? What went on that you realized how grave this was?
The day that I got it, I was just working like normal. I get bit constantly. I'm a farmer. I'm outside constantly. I don't think anything of it. I think a lot of people in Hawaii, especially the people that live more rural like I do, we just don't worry about mosquitoes anymore. We just ignore them. So I really didn't take any precautions. Once I understood after I got bit, I saw how sick my friends were, and I was starting to hear about it. I started watching my fever really closely, and I was kind of celebrating on the 8th day, 6th, 7th, 8th day. I was like, oh, I feel good. I think I'm okay. And then the night before my fever hit, I noticed that I wasn't hungry or I couldn't eat my food. And it was about 24 hours later that I knew something was off, and then I checked my fever, and in about 3 hours it went from 0 to 104, and I was in a lot of pain.
You took yourself, or you went to seek medical care.
It was night, and so I was nervous, and I was really out of it already. 104 fever is a big deal. I remember trying to Google, and I couldn't open my eyes. I was in a lot of pain already, and I was trying to, because I had never had 104 fever. I don't know who has. I mean, it's pretty rare. So I was trying to see, is this dangerous? Do I need to? I don't know if an ambulance can get down my road. I don't know. So finally, I crawled out and I got all the ice and all the ice packs and chill packs out of my refrigerator. It was about 1 in the morning, and I just covered myself. And then I waited till morning, and I kind of barely remember it, but a friend of mine demanded and dragged me to the hospital. But I was still, and I just didn't want to move. I was in so much pain. I was trying to convince her, I'm fine, I think I'm better. But she's like.
And you sent us some photographs, and when I asked you about them, you said that actually, the photographs, as our viewers will see, show you with an extreme rash, skin peeling off of your hands. And when I said, oh, this must have been at the worst, you said this actually wasn't the worst. This is when you felt better. So the photographs that our viewers are looking at now, this actually wasn't the worst of it.
No, not even close. This was kind of almost a relieving point of it. I wouldn't have been able to take a picture or think about taking a picture at that point. The worst part is the pain and the delirium. You can't sleep. I didn't sleep for, I think, about 5 days. And my mother took a week off of work and waited on me hand and foot and forth, because I didn't want to drink or eat. And she, treated me like I was 4 and forced me to drink water and kept me safe. But she didn't sleep either, because I wasn't sleeping. So it was hard to watch her go through it, and it was just traumatic for everybody involved. It was traumatic for her husband. It was, I'm going to say the pain was the worst, though. Yeah. The pain was really bad.
Senator Ruderman, you've expressed concern that not enough has been done in this outbreak. Can you tell us why?
Sure. Well, we greatly appreciate all that has been done, and many things have been done wonderfully well. But I and many others from my community feel that there was a delayed response upon the first cases occurring. The response was rather sluggish in getting started, and some things were done much too slowly, and some things have never been done yet that I think are crucial to reach the very rural population.
Such as?
Well, such as more education efforts. I really think that the average person in my district has not gotten the word yet. They don't understand what the symptoms are. They don't understand what to watch for and what to do about it. It's just something they've sort of heard about. Because we have, not just in my district, but many parts of the Big Island, a very rural population, many of whom are disconnected in the sense of internet or TV. They're not tuned into that kind of thing. They don't get the paper, they don't watch TV. So the brochures and things that we've handed out, which are excellent, have not reached most people. And so there's a lot of people that are simply scared and don't have the information that they need. And then we also share the concern that some of the actual responses could be better in terms of testing, mosquito control, but primarily outreach to the medical personnel, medical providers, and outreach to the community has been incomplete, in my opinion.
Mr. Oliveira, do you agree?
We can definitely do more. Communication is always our Achilles heel with no matter what incident we're dealing with. And as Senator pointed out, there's some unique issues on the Big Island. Not everyone has access to telecommunications, broadband services, and even the services we have, there are areas that aren't covered, like for our radio messaging. So there's definitely areas we can improve on, and we're always looking for ways to get more information out. You know, an excellent conduit for us has been the school system, because at least with getting information into the schools, information going home with the children to the families is another tool that we've used. So we are, every day we have conversations about how we can improve on the information getting out to the community.
Senator Ruderman, do you think that there's any reason that the response would be slower than what would be hoped for? Some people feel that perhaps people are concerned about word of dengue fever getting out because of our tourism industry. Do you think there's any truth to that?
I do. I think that the response has been measured and reduced out of concern for tourism. And while that's a legitimate concern for all of us statewide, I feel like this is the kind of thing where information available quickly is the way to deal with it. And, you know, so trying to sweep it under the rug or minimize it is the opposite of what we need to do. And even in thinking about tourism, the long-term best outcome for tourism is that we eradicate this. And even if we needed to have a short-term alarm sounded that helps us eradicate it, it's certainly much better than it becoming endemic, because that's going to have a profound effect on tourism. And if it does become endemic, the idea that it can be limited to the Big Island, I think is a little bit foolhardy. I think it will ultimately expand to other islands. So I think the right way to deal with it, even though there are tourism concerns, is to do everything possible as quickly as possible and prevent it from becoming established.
Dr. Pressler, do you think that there has been any soft playing the response to this, whether out of concern for tourism or just alarming people?
Definitely not. And first of all, I appreciate Senator Ruderman's concerns about the community, and as Director of Health, I have concerns about protecting the community, and my own family all lives on Hawai'i Island. I have 4 siblings, nieces, nephews, grandnieces and nephews, cousins all over the island there. So I have a vested interest in this as well. I can assure you that the response, and this has been verified by CDC's independent investigation of what we've done, was timely and appropriate. As Chief Oliveira suggested, our communications were lacking, and we knew that. We used to have 5 people in our communications office in the Department of Health 8-10 years ago. We have 1 person for the entire Department of Health.
So state cuts are catching up.
So we knew we had inadequate communication, and that was the first thing that we brought on, was to try to get some surge capacity on communication, particularly because the Big Island is a particularly difficult, because of the geography, and because there are people who don't even have radio or television contact, and people who don't want to have contact. It makes it a particularly difficult community in order to penetrate and get information out to everybody. And that's why we started the Fight the Bite campaign, and these things were going home with kids from school. They were being handed out at church. We did not in any way, we immediately were working with the Department of Tourism and with the hotels and others to try to get the message out. There was never, ever any suggestion of trying to keep this. We were trying to protect people, because the only way we're ever going to end this outbreak is to have everybody informed and have them get rid of standing water and protect themselves from mosquito bites.
Ms. DePertis, you mentioned being in a rural setting. You would be perhaps an example of what everyone's talking about, one of the beauties of the Big Island being its rural nature. Had you had any information or communication about dengue fever, other than your friends mentioning it?
No, not prior to it. It seemed to, I think I got sick kind of as it started to have a peak experience, and right when I got sick, there was a lot more talk, a lot more education going out. And then, so within that first 2 weeks of November, I think there was a lot of communication that was everywhere and accessible. Just, I think I came a bit too late. That's all.
And it's a very complicated disease, so it's difficult to explain to the community. I mean, even trying to explain it to some of my colleagues, it's a difficult disease to explain.
Where do we think this came into Hawaii? You were explaining earlier that in any given year in Hawaii, we'll have 13 or so cases of people traveling in endemic areas of the world. 40% of the world live with this as a day-to-day reality, not an outbreak. They'll bring dengue fever into Hawaii, but basically it never becomes an outbreak.
Yes, with 40% of the world having dengue endemic, and with all the travel that people do, it's not uncommon for there to be isolated cases of someone who's been traveling and comes back and then gets sick and then is diagnosed with dengue fever. As soon as we know about that, the disease investigation team at the Department of Health contacts that individual, and it goes to their home and is communicating with them, finding out if there's standing water, making sure that all those things are eliminated, spraying if appropriate, and educating that individual to protect themselves from getting bitten by mosquito bites so that it doesn't spread.
So what happened in this case that it did become an outbreak?
Yeah, well, in this case, we don't know for sure, but it would look like the hot spot was around Ho'okena Park, which is why as soon as this became clear, the mayor and Daryl Oliveira, this is a chief of Hawaii County Civil Defense, closed the park because that seemed to be the hot spot. So not only was that a place for tourists to come, but also a very popular place for local people. And so that is probably, that was a likely place for mosquitoes to be getting infected by an individual, and then after their incubation period, passing it on to more individuals. And
Chief, maybe I can then ask you this question from David from the Big Island. We would like our beach park reopened. What is the purpose of keeping Ho'okena Park closed if the outbreak is island-wide? Could you take that question?
Right, because the initial cases had some common interest. There's evidence that suggests that's where the point of origin for the outbreak was. And as part of the vector control and response to that is going out and surveying the area and identifying that there is a large population of the mosquito, the species that is responsible for continuing the spread of the dengue. What we'd like to do is continue spraying and treating the areas and go beyond the life cycle of some of the adult mosquitoes.
So break the chain.
Right, exactly. And this is a common practice when we consulted with Dr. Pang, who came down, again, thanks to Dr. Precious sending, the doctor from Maui that was involved in the outbreak. He shared the same sentiments that that's what they did on Maui and was necessary to limit the continued spread, like I said, break the chain. So our goal is to open the beach as soon as possible, the park as soon as possible. We want to make sure that it's safe for people to visit.
But no opening date as of now?
Not right now, no.
All right. Senator Ridgeman.
I appreciate David's wanting to get back to the beach, but I really appreciate the County Civil Defense taking the action of closing that park. And, it's little known, but in '93 there was an outbreak on the Big Island that was also centered around Ho'okena. So it is a hot spot, and it is a great concern. I think closing that beach was an appropriate and a much appreciated action.
All right. Here's from Mark from Alewa Heights. Why not use DDT to kill the mosquitoes? Dr. Pressler, do you want to take that one?
well, I think maybe Daryl wants to allow. As far as I know, DDT is not allowed anymore.
Correct, because it does have significant implications with its use. Historically, why it was taken off is because of those other implications and environmental impacts. The product being used by Department of Health as part of the treatment has been demonstrated to be very effective in the adult mitigation efforts. So we're sticking with that product and using it, again, because of proven results and demonstrated efficacy with the product.
And where is that spraying happening?
Right now, it's focused primarily around the confirmed cases, as well as in those hotspot areas such as Ho'okena Beach Park. The practice for vector control is once a confirmed case is identified, and even for some of the suspect cases where people are awaiting the lab results, they'll do a site survey. So they go out, they evaluate the property, identify breeding areas or areas of concern for mosquito propagation, and then they start to target spraying around those properties out to 25 yards. The goal is to try to control the adult mosquitoes and, again, break the chain of the spread.
Ms. DePerdes, did you have spraying around your property?
I did. I got tested Monday. I got the results Friday, and the next 3 Sundays, people came out and sprayed. And this may seem small, but I don't know how you train the people, but every single time they asked how I was and they expressed concern before they did a really efficient job. It was actually incredibly comforting, that moment that they were kind and caring about it, like you did when you said, I'm sorry that you got this. That actually means a lot, just the kindness of acknowledging how hard it is. So not just treating it like...
Well, I'm glad to hear that.
Good to hear.
I don't wish dengue fever on anybody.
No.
Right. It was actually really nice. Yeah.
All right. Eric from Hilo asks, if a mosquito is infected, can it pass the virus to its offspring through its eggs?
Well, that was the question. The CDC has done studies on that in the laboratory, and there's some data to show maybe the eggs can carry the virus, but there hasn't really been any documented real life where the eggs hatch and carry dengue.
But it hasn't been ruled out.
Hasn't been totally ruled out, but it's not a high concern.
All right, let me ask this follow-up question. Susan from Kahala, should we be concerned that dengue fever could become endemic to Hawaii?
Well, that's what we want to prevent. And the best way to do that is for everybody to get rid of standing water and to make sure that they protect themselves from mosquito bites, and then it won't become endemic in Hawaii.
So maybe I could go back to Chief Oliveira. In terms of standing water, and perhaps, Senator, you could speak to your area as well, what instruction is being given right now to Big Island residents, and should that instruction also be happening to residents on other islands just as a preventative measure?
Yes, well, some of the things that are ongoing is in the messages that we put out and the information going out is what people can do on their own properties to address the issue of standing water. Whether it's plant or foliage that's a collection site, how you can treat that using larvicides, soap and water solutions, and other home remedies that make it pretty easy for an individual to take care of what's on their property, as well as just dumping the water out.
Where would one get larvicide?
It's available in many of the garden shops. We've been acquiring it through several garden shops in town, in Hilo. And we're also working with the Department of Health with other products and identifying with the Department of Agriculture other products that might be made available for those that can't acquire it financially, how the county might be able to help them with that.
All right, well, and of course soapy water is a classic in Hawaii. Go out, put a film of it basically on the water.
Right, you're trying to, one is prevent the larvae from being able to break through the surface and become airborne, as well as break the surface tension and prevent future settling of the eggs. And the best thing is if we can eliminate the water altogether. And we know that, especially for the Senator's District, with water catchment systems as the primary source of everyone's potable water, it's difficult. So we're also trying to find solutions for that as well.
Senator, what are you seeing people do in your area? Are you seeing people take these measures?
No, I'm actually not seeing that very much. I think that in my area, you know, 90% of my district is on catchment, which is a potential breeding ground. But even more so, and one of the reasons I'm so concerned is that we may well control mosquitoes in certain areas in Kona and in Hilo, but no matter how much you treat your yard and your landscaping, Puna is a large, wet, mostly jungly area, larger than the island of Oahu. Most of it is pure jungle. No one's living there. No one's cultivating it. So my great concern for my district is that if it settles in the Big Island, we're going to have it the worst because there's no way we're going to get rid of the mosquitoes in the jungly expanses.
In other words, if it becomes endemic.
If it becomes endemic. And I think possibly for that reason, people take the cautions that have been issued less seriously. I know some people do go around and treat them, but I don't know anyone that's gone up and checked their gutters to see if there's standing water up there.
It's not happening.
I don't believe it's happening. Mm-hmm. I don't see any evidence that it's happening.
Of course, you do not want to put soapy water or larvicide in your water catchment. Mm-hmm. What is the solution for someone who's got water catchment?
Right now, the best thing you can do is keep your catchment covered. And we understand that's also a financial burden for some people.
Because you're not getting...
Right. And if we can keep them covered with whether the mesh, ideally it's a hard cover, but again, it can be cost prohibitive, but a mesh cover and making sure that cover stays off the surface of the water. We are, like I said, working with Department of Agriculture, trying to identify, there used to be products on the market available for treating potable water systems. Unfortunately, that has gone, and we're trying to identify a product that would be practical and safe to use for potable water.
How do you keep, if you're using mosquito netting, how do you keep that from not sort of settling down onto the water surface? There's
several techniques. You know, the retailers provide a framed system that can keep it off, but simple things like putting a flotation device, like a beach ball under the saran or that mesh will keep it off the surface of the water.
Did you want to add something, Senator?
Well, another complicating factor is it rains a lot, and it's been raining in my district, and all the mosquito treatments, both the residential ones and the official ones, are much less effective if it's raining every day. And that's just another complicating factor that's unfortunately especially true in my neighborhood.
Mm-hmm. Yes.
I had a couple of questions, I guess, for the panel. Because of the people are pretty inventive around me. A lot of people are spraying garlic water all around, and they were saying that that's helping. I heard some of my friends are putting either bleach or soap directly in their catchment tank. Do you think that that's effective, or do you think that's...
In talking to the CDC, the bleach has demonstrated some benefit and effectiveness with controlling the larvae. Right now they're trying to give us what is the appropriate concentration so that we don't have people making their catchment water systems overly bleached or chlorinated. So we'd like to provide more guidance along those lines. And there are other home remedies, like you said, the garlic water solution. If it is helping to repel the mosquitoes, that's at least preventing people from getting bit. And again, as long as what they're doing is safe, because we don't want to create other health issues with what they're using.
All right, let me go to this question from Ka'u to Dr. Pressler. You're saying that there are very few episodes of dengue infections, but there are lots of people on the Big Island that are not tested. Can we get a more accurate count? Is it possible that the numbers are much larger than what we know
Oh,
of?
I'm sure the numbers are larger. I'm sure there are a number of people who have had dengue, didn't know it, or they haven't been tested. And so our big push has been to educate so people do get tested so that we can get a more accurate accounting of how many cases there are.
So it could be double the figure, it could be triple.
The good thing is that we have seen, I know we're getting a message out at least to the physician community, because it started out that many of the cases that came in were testing positive, and then it was like, well, 2 were negative for every one. Now it's 4 to 1 of negative to positive tests. So that means that we've reached a point where people are getting tested with a very low threshold of
because of their concern.
yes. So that's a good sign to me that there's no hesitation for people to get tested to see if they do have dengue.
Speaking of numbers, what is the number at which you go, okay, hopefully we've reached the point where this starts to burn itself out? Is there a number?
Well, we would want to see at least a month. I'd probably want to see more than a month with no new cases of dengue before we would say that we've put an end to this current outbreak.
And we're not close to that yet.
yet.
All right. This is a question from Nu'uwanu. Why can't we produce a vaccine to become immune to dengue? How much in time and cost would this be? I believe there is currently a vaccine in sort of the works.
There's a vaccine that's being tested. It hasn't been approved by the FDA for the United States yet. There's also a group here in Hawaii that's recently received a grant from the military to look at vaccine for dengue. That vaccine would probably be used for troops going to endemic areas. In a place like Hawaii where dengue is not endemic, it would be, you wouldn't probably vaccinate everybody, but if there was an outbreak, then you could be vaccinating all of the people that might be at risk if, once it becomes available. But right now it's not available to us yet.
All right. Let's see, from Mahialani from Kalapana, will Senator Ruderman be advocating for more resources for the Department of Health in the upcoming legislative session?
Yes, I'm always advocating for more resources in the Department of Health, as well as several other departments. Not everybody listens to me. But I think in this case, I do believe that they struggle with inadequate staffing. But it's one of the cases where I think more could be done. There's no reason we couldn't ask the National Guard for help. We could have declared a state of emergency and had much more resources brought to bear. I think it's wonderful that the county got involved, because I think they brought community meetings and resources that the Department of Health didn't have the ability to do, and was very much needed. So I believe we need much more staffing at the Department of Health, but I also think that we could have had a more concerned attitude of addressing this as an urgent situation, even though it was on the big
Well, actually, I appreciate that, Senator Ruderman, and we look forward to getting some requests for additional support for us. There was a full-fledged support for this effort. We had federal, state, and county efforts going into this in all of our departments, and we had resources coming from all the other neighbor islands to Hawaii Island to help with the outbreak. We have the National Guard involved. We have Department of Agriculture, Department of Land and Natural Resources, Department of Education, Civil Defense, Department of Transportation. I mean, we had a full court press from the governor's office, everybody. I mean, this was talked about at all of our cabinet meetings. And so we really have had the entire state with federal support to try to put an end to this outbreak. It may not have been totally apparent to you, but that has in fact been the case.
And once again, I appreciate all the efforts that have been done. But one of the things that struck me was that it took 2 months from the first case and 1 month from the time that the department announced it to reach all the medical providers on the Big Island. And there also was apparently an extreme hesitation to ask the CDC to come and help. I asked this question, I had to ask 4 times at our informational briefing about a month ago, have you asked the CDC to come and help? And it took four times, did not get a straight answer. Sometime after that, 6 weeks into the known outbreak, was when the CDC came here. I don't see why we didn't ask for all the help possible as soon as possible.
Yeah. And in fact, the CDC was involved from day one. I mean, that's the first thing we do is talk with the CDC to get guidance. And so they were part of the team from the very beginning. And then we set up the unified command under the Hawaii Civil Defense under Chief Oliveira, who is the incident commander. Daily conference calls, and CDC was all part of our team from the very beginning. At some point, because of the concerns that we weren't doing enough, we did decide that we should bring the CDC out in person, and we had an independent investigation by Dr. Lyle Peterson, who was out here a week or 2 ago, and he submitted his report and did in fact say that our response was timely and appropriate. We were lacking resources and communication, and we needed to get more resources to be able to back up the vector control and our epidemiologists, but that they were in fact doing the appropriate things.
All right. Tonight we're talking about dengue fever in Hawaii. Please call, email, or tweet your questions and comments. Call 973-1000 if you're calling from Oahu, and 800-238-4847 if you're calling from a neighbor island. One comment that has been made by several parties is that tourists are expressing concern that they weren't given information about this, that they didn't know that this was happening. We have a question comment from Jay in Kailua Kona saying, even today at Kona Airport, several travelers commented they saw no notification about the need for caution about mosquitoes, about the outbreak. Those state DOH and state DOT say they are posting flyers. Kona Airport has very few walls and many travelers will not see any signs. Why doesn't state DOT hand out a simple flyer to each incoming flyer? Just advising caution. We have a moral obligation to do that. Chief, maybe I can toss that to you. Sure. Would you like to see more outreach to our visitors coming in?
Well, we are, and we have from the start, and looking again, taking the comments to heart, that we can do a better job, obviously, if there appears to be a lack of information getting out there. We are working very closely. One of the things is maybe a well-kept secret from the public is when an incident occurs, regardless of the emergency, is the organization or the assembly of all the stakeholders coming together and discussing the response. Department of Transportation was part of that team that came together. We have been sharing and producing literature to go out for the tourists that includes both at the airports, the resorts, as well as producing multi-language cards for even the rent-a-car businesses so that they can make it available for the tourists.
And are those currently being passed out? Today were they passed out, or is that something that's coming online?
No, they have already been going out, but obviously if there's indication that maybe it's not going out as much, we can look into that and work closely. Hawaii Tourism Authority, Hawaii Visitors Bureau, they've all been part of this conversation and the efforts. And it's a good thing to go back, take the comments we're getting from the viewers and the public and say, well, if there's gaps, we can still close those gaps.
Ms. DeParadis, do you have to continue to worry about this, or have you been told that you basically, having had it, having recovered, that you no longer need to worry, that you're immune?
What I've been told is that there are 4 main strands of dengue. The doctor at the hospital told me that we only have strain 1 in Hawaii. But for someone like me, I've traveled all over the world, specifically in tropics. And I hope to continue. I am immune now to strain 1, but if I get one of the other strains, then it's much more severe.
It compounds.
It compounds. And I can honestly can hardly even imagine that.
So at its worst, when you had this, can you explain to us, they ask on a level of 0 to 10 your pain threshold. Were you beyond 10? How
10,
bad was
yeah.
it?
I mean, if 10's it, then yeah, 10 was it. Yeah, it was just a constant, I hardly even remember it now.
Delirious.
Because it was coupled with delirium. So maybe that's a blessing part of it. But yeah, it was just constant pain, and the pain just kept moving. So it was just like a constant, it wasn't dull, it was a constant sharp and moving and increasing pain.
And then is there also the worry that perhaps during the time during which you were infectious and perhaps not aware that then neighbors or people in your area could be at risk?
I was incredibly worried about that. I have a lot of people close to me, a lot of kids that live really close to me.
And of course, this is not like the flu. It cannot be
Right.
passed person to person, but mosquitoes in the area of your
Right.
home.
Like I said, my mother insisted on being there with me. I was really afraid that she was going to get it. But of course, she's a mother, so she stayed. So yeah, that was absolutely part of it. And as the weeks went by and the people, but we're not getting sick, it was a big relief. But even though it was embarrassing, I will say that the second that my fever spiked, I contacted everybody I had been around in the past week and just told them to take immediate precautions. And they all did. They all took it seriously and started, ripping out their bromeliads and spraying in whatever fashion. Even if the DOH wasn't coming, they were hiring people to spray their own property. And I think that that's really what did it, is that they acted in their own home or in their own place of
See,
business.
if everyone did what you did, that we'd put an end to this.
Because they knew someone personally, right? Maybe that leads us to this question. Ralph from Kona, why can't we do aerial spraying at night after notifying residents to stay indoors like they do on the mainland? Any reaction to that?
We've been looking at all the different alternatives, and one conversation we had with CDC was specifically that. The challenge you have is whether or not that the products used would actually have the effect when you try to drop it from the air. And historically on island and across the state, there's been spraying done or fogging done in an effort to reduce the specific mosquitoes using vehicles through the neighborhood. So we are looking at, again, what's the most effective way to address this? And right now, with the resources that we have and around the confirmed cases, that appears to be the most effective way to try to get control of this first. We will never eradicate mosquitoes in Hawaii. The environment just won't allow that.
So in other words, you have considered such a thing as aerial spraying, but it's a question of finding whether that will work.
Will work, right, based on the application.
It's limited effectiveness because what you need to get to the underside
Right.
of, so you need the fogging, as the chief mentioned. It can't just be the aerial spraying. And with the dense foliage we have, it's not going to penetrate and get to really eliminate the mosquitoes.
Senator, would you like to see something like that done?
I would. In fact, Aedes aegypti, the mosquito that at least was the main culprit originally, has actually been eradicated from 3 of our Hawaii counties. The Big Island is the only one where we have not eradicated from. So while it's not a short-term strategy for controlling this outbreak, I believe it's a mid-term strategy that we should aim to do that. And I myself am very concerned. Once again, because my neighborhood will never be free of mosquitoes, but this particular mosquito is not the most common one, and we could address areas where it occurs. I have a wife that's 7 months pregnant, and we worry about it. This could threaten her pregnancy.
So, Senator, would you want aerial spraying of DDT and such things around your wife who's pregnant and around the organic farmers?
I wouldn't want DDT spraying for the reasons that Darrell said. I believe that some other mosquito control is appropriate. And I think that in my immediate area, we don't have the Aedes mosquito, so it would only be targeted to areas where we have that mosquito. But I'd rather eliminate Aedes mosquitoes than face this over and over again. And I think most people would agree with that. I don't think DDT is the only answer.
Yeah, well, we would all like to get rid of the mosquitoes. CDC's evaluation was we're not going to be able to get rid of the mosquitoes, but we can take actions to prevent people from getting bitten by mosquitoes and try to prevent the spread of the dengue.
Gloria from Kealakekua asks, would it be possible to develop GMO sterile mosquitoes to control the population?
Yes, well, that's also been looked into, and I think Florida is trying to get FDA approval for that right now. There apparently is a sterile male mosquito for the Aedes aegypti. As we've been doing the trapping of mosquitoes on Hawaii Island, it turns out that the Aedes aegypti is not as much of a culprit as we thought it was. It's probably mostly the Aedes albopictus. and there is not a GMO sterile male mosquito yet. I'm looking forward to the time there is, because I would hope that we then might be able to use that, which would be a much better way to try to reduce the mosquito population rather than spraying.
Let me ask this follow-up question, Susanna from Ka'u. What can be done to test everyone that is a suspected case, regardless of ability to pay, i.e. free testing? Is there free testing for this?
Yes.
Yes, as part of the outreach, we, again, assembling the team in partnership with Dr. Prester and her team at Department of Health, the Hawaii Healthcare Association, they've reached out to all of the facilities, and we actually convened a meeting at the Emergency Operations Center at Civil Defense. That included all the rural health centers. Everyone has committed to taking anyone in regardless of ability to pay. And the mayor has been very committed to this and has extended the outreach to include our EMS or our fire and paramedic services, that if someone can't get access to healthcare, call the 911 system or go to a fire station. You will then have access to someone to come do an assessment, capture the information. If you're symptomatic, get you the care you need. Because one of the things we need to remind the public is, although there's a concern for dengue, some people may be suffering from other health ailments that if we pass it off as you might have had dengue, they could suffer much more severe consequences if we don't get them in for appropriate assessment and health care. So part of that is reaching out, trying to make sure they have access to health care, get them screened, and as I said, all the facilities have been committed to taking in cases regardless of ability to pay.
Senator.
That's one of the areas that I think much more could be done, should have been done and could be done, going out into the community and providing testing and education. There was at least 2 different medical vans that have been offered for use in this outbreak, and for reasons I don't understand, we have declined to put them into action, but they would be tremendously valuable in going out to farmers markets and remote communities. I have areas in my district that are an hour from the closest clinic. A lot of people don't go to the clinic, and I think outreach into the hard-to-reach parts of the community is what's missing, and those are the people that are not getting tested, and those are the people that have not gotten the education.
Well, we have in fact been doing that with the
Right.
EMS crews, and having with them someone who can draw the blood as well as collect the clinical and demographic information so that we can do a complete response and follow up on these individuals. And you've been going to homeless and to fairs and to areas that are hard to reach.
Right, in partnership with some of the social service programs, in particular Hope Services, using them as a conduit to our homeless population, and then working through some of the farmers co-ops, reaching out for our maybe migrant workforce that may not be getting the information because English is not their primary language, as well as maybe some cultural barriers. So we have been deploying what we call multidisciplinary teams, which consist of fire, EMS, Department of Health, public health, nursing, as well as even from the Hope Services and other organizations, to go out and try to get to these people, especially if they're symptomatic, start the process, getting them care, and then getting them screened.
All right. David from Pauilo. I haven't heard how dengue fever is spread. Does the mosquito bite an infected person and then transmits it by biting someone else? You explained to me earlier before the show that there is a life cycle involved in this, and that is one of the things that makes this so challenging to track.
Yes, well, David's description is correct. It's a mosquito that's infected, and then that mosquito bites an individual 3 to 10 days later. That individual 1 out of 4 individuals will become symptomatic in some way and have symptoms such as you had. And then while that individual is sick, if they get bitten by a mosquito, that mosquito then 3 to 10 days later after that can have that virus in their system, and then if they bite an individual, that passes on. So it's mosquito to individual to mosquito, but there's a lag time in between each one.
Yes.
Is it only when they have the fever, or is it the entire time? At what point are they acutely contagious?
During the time that you're sick. Yeah,
The
but
fever-
The fever
the
seems
fever
to
itself.
be the height, the most serious time.
Okay.
So had you had more information or known earlier and gone in earlier, could they have helped to alleviate your symptoms? Would this have been less severe for you?
I don't think so. Not that I've heard. I hear that you just let it run its course, and staying hydrated is the most important thing. And the danger can be the platelet count, is what I hear, the blood clotting.
Well informed, yes.
Well, I had a lot of time in bed to Google. And I jumped on the papaya leaf bandwagon and was drinking fresh papaya leaf 3 times a day, especially during the fever. And I heard that that has a high platelet count to help lower the risk of the most severe cases of dengue fever. So I don't know, I think staying hydrated and checking the platelet counts, I think, is the only thing to do medically. The rest of it is just easing the symptoms and waiting. That's as far as I know.
Yeah, that's correct. And it's just as the fever is breaking is the most serious time when the platelet counts can drop, and so you were already in the hospital under care. And that's the time we worry about, that make sure that people are under medical care so that they can be supported during that time, which is about a 24-hour period of time, which is the most dangerous part of this.
And no one has died of this in this outbreak
That is correct.
that we are aware of. All right.
Everybody so far has recovered and is now immune to that type of dengue.
That one. All right. Denise from Captain Cook. I had all the signs and symptoms of dengue and was tested within 24 hours, but I learned later you should be tested 3 days later. Which should it be?
It depends on that's why it's so important to find out the history, when was the onset of disease and other factors, because it depends on where you are in the disease process, whether the lab should test for the active virus or whether they should be testing for the antibodies to the virus.
Let me ask this. Cheryl in McKenna, what has the Department of Transportation, the Department of Health done for the tourist population? May I add, is there any talk about a flyer on the airlines as the flights land in Hawaii? Anything a little bit more direct? Any conversation about that?
Yes, like I said, Department of Transportation has been engaged from the start, as well as the Visitors Bureau and Tourism Authority. So again, it's looking at what other ways we can get word out. As coming over today for this meeting or this opportunity, I did see in the Hilo airport that they have the posters up, as well as at the various cash and small convenience shops in the airport. So they are getting information out there, whether it's an actual airline distribution in the flight. I don't think so at this point, but we'll work with the Tourism Authority and the Visitors Bureau on every opportunity to educate people coming in.
Senator?
One thing that the CDC reviewer commented on, that he didn't see anything about it as he traveled or came to his hotel. And I'm not aware of this kind of education outreach, but I think it's important. I think it's kind of lacking right now.
Lee from Maui asked if there's any discussion of spraying on aircraft to prevent this from spreading to other islands.
Not at this point. If I could just add a little bit on the tourist side, a study was done with the 2001 Maui outbreak, 4,000 tourists that were involved around that time. And what came out in the CDC's report was that, again, there's evidence to suggest that the tourists are at low risk based on their activities and the properties and what they do. It may be those that are involved in some of the backcountry activities that might be more at risk. But around the resort properties, again, talking to many of the resort properties, making sure they're aware of the mitigation strategies with controlling mosquitoes on property. Again, the risk to our tourism population, our tourist population, is very low considering.
All right. From Glenn in Nanakuli, what's the status of dengue in Kalama Valley, Oahu?
There is no dengue anywhere except on Hawai'i Island right now.
There was one case that was discussed on Oahu, but it turned out to be unrelated to this outbreak.
There was one case earlier a few months ago, and that was a case of someone who'd been traveling who came back and was diagnosed with dengue fever, and that was the end of it. Because again, our disease investigation division was there. We checked out the premises of that individual and counseled the individual about preventing mosquito bites, and there was no further spread.
Is it premature for residents on Oahu, Maui, Kauai to be putting soapy water and standing water on their properties to be starting to think about this?
Well, I think if we can get rid of mosquitoes, that'd be everybody's dream, to get rid of them altogether. Because again, we're talking about dengue, but there's other diseases that can be transmitted by mosquitoes. Maybe not these particular species, but others. We have avian malaria to think about, West Nile virus to think about. So anytime we can control the vectors or minimize the vectors out there, we're doing something in a positive.
We really want to educate everybody in the state about the fight the bite. We want everyone to try to get rid of standing water in their yards and to protect themselves from mosquito bites, because right now it's dengue on Hawai'i Island. It could show up on another island, and we don't want it to go further. And it could be Zika virus or chikungunya or others, because those are all carried by the same vector, by the Aedes albopictus and Aedes aegypti. So we want everyone to be aware of this most of the focus has been on Hawaii Island because that's where the outbreak is, but we do want to educate everybody in this.
You'd like all Hawaii residents to be checking.
We really would, yes.
All right.
We are trying to spread the word. No one is trying to keep information from anybody.
From James Krause, what about reported shortages of mosquito repellents? Are you hearing such complaints in Puno?
Well, this was severe in the first few weeks. You know, all the main stores were out of mosquito repellent almost all the time. I'm not sure why that is, because really we could have UPS'd in some boxes and gotten them rather quickly, but an almost complete shortage of mosquito repellent occurred in the first 2 or 3 weeks after the announcement of the outbreak. I think that's something that can be looked at for a better response next time.
Is there discussion in terms of going forward in the future, what needs to change so that this is...
Yes, we learn from every experience, and we were just talking about that today, about not only have we had an initial report from the CDC on about the things we should be doing immediately, but when we will be debriefing when this is all over, lessons learned, what can we do now to prepare so that we can be much better the next time there's an outbreak of any kind. There's always something to be learned anytime we go through these kinds of incidences.
If I could add to that repellent issue, you know, again, from the very start, there's been an effort at the incident operations to try to maintain contact with the retailers and make sure they were aggressively pursuing the product to make it available, as well as with the distributor, and even reaching all the way out to the manufacturer. You know, in addition to that, we have materials coming in shortly. The mayor's been purchasing using county resources. A lot of it has been focused on making sure that the resources are available, again, for those less fortunate or unable to acquire the products to take care of themselves. But as Dr. Press said, many lessons have been learned with this particular outbreak, and we'll be better prepared in the future.
All right, Kelly from Kona, is the pamphlet that Dr. Pressler held up available in languages other than English?
Yes, it's translated in at least 10 languages, last I knew, on our website, and we are trying to go further than that so that everyone has access to it.
All right, Chico in Honolulu asks, Dr. Pressler, what is the status of vector control as far as personnel numbers? Vector control was gutted during the last administration.
Well, it wasn't just the last administration. I think over the last 8 or 10 years, we went from 15 vector control personnel on Hawaii Island to 4, I believe. So we do want to rebuild that capacity, especially because, as I said, today it's dengue, next time it may be chikungunya or Zika or something else, and so we need to have that vector control capacity, and that was one of the recommendations that the CDC made, to rebuild that capacity.
Mm-hmm. Ms. Dupertis, when you drive around now and you see standing water in any manifestation, are you tempted to sort of pull over and talk to people? I mean, how vocal have you become now after experiencing what you have?
I'm just trying to encourage people to take it seriously. I think that's what I didn't do. I do feel, because I'm a farmer, I feel really sad about all the bromeliads because they're everywhere and they're just perfect.
And of course they pool water for anyone.
I don't want to pull them out, or I don't want to destroy them, but I cringe every time I see them. I cringe every time I see standing water.
And of course heliconia, I mean, so many of our plants are just, right? And that's where the Big Island, with all of its beauty, how do you even start to fight that?
Right.
It's a challenge.
It's a problem. All right, let's see. Why are the active or suspected cases not put in a mosquito-free space so the mosquitoes cannot spread the disease? From Jack on Maui, I suppose that would mean basically containing people.
Yeah, well, we try to educate people to put themselves in a mosquito-free space. We're not quarantining anybody because we do not want to discourage anyone from getting assistance and from coming forth with their illness. So, but that's basically what we're doing, is telling people to be in a mosquito-free space.
We have about 2 minutes left. Maybe we could go around the table. If you could sort of wave a wand and have something at your disposal right now to help fight this, what would it be? What would be on your list?
I think it would be just continued public support and their participation and being really, I guess, conscientious about the fight the bite, because like I said, even though we're talking about dengue right now, it's other things. And if you go back to the original cases, if we had education back then and people had protected themselves from being bitten back to Ho'okena, we wouldn't be having this conversation today. So I think if we can continue to encourage the public's participation and their adherence to the guidance, we can beat this.
Do you think there are people living in pockets of the most rural areas of the Big Island that have not even heard about this or are not aware of it?
I'm sure, and that's where, again, like the Senator said, we have to look at different ways to reach out to our community and make sure that we're getting the word out effectively.
Is that walking and canvassing, or?
If that's what it's going to take, and I think, we've learned lessons with previous disasters, and partnerships were built after those with community associations, the faith-based community. It's using every forum we can think of and vehicle we can think of to get out into the community and make sure that everyone's getting the word.
Senator?
Well, again, I would like to see outreach into rural areas much more effectively than now. I don't understand why we don't send vans or personnel out to remote farmers markets and community associations to talk to people who don't come to town. And the idea of having brochures online is fine, but these people aren't online. So we have to get to them. We have to reach them in their language where they live. And I think that hasn't been done. What I would like to see different is, I would love to see Big Island problems or Outer Island problems treated with the same urgency that they would have if they had occurred on Oahu, because even just strategically, we should address every issue as strongly and as urgently as we can so it doesn't spread to the other islands.
And we're going to have to end there.
I just want to say that the Big Island has, in fact, been treated as urgently as it would have been if it were here on Oahu, Senator.
Thank you.
All
Take
right.
it very seriously.
All right, thank you all for sharing. And Ms. Dupertis, thank you for sharing your personal story. Thank you for joining us tonight. Insights will be on hiatus for the next 2 weeks, and we'll return on January 7th for a look at Hawaii's changing workplace. As more baby boomers reach retirement age and more millennials enter the workforce, managers say they're noticing some changes in how their employees work. On the next Insights, how are millennials changing Hawaii's workforce? That's next time on Insights on PBS Hawaii. I'm Malia Maddock. A hui hou.